The final learning outcome we have with regards to epithelium is looking at the way epithelium changes in response to stimuli, and we refer to that as epithelial adaptations. Everything we've looked at up to this point with epithelium is epithelium in its sort of truest form, in its textbook way, the way it first originates. But unlike other body tissues, epithelium is exposed to the external environment. So if you think about muscle or nerve or even connective tissue, that's contained within the body and it's surrounded by this protective layer of epithelium, but nothing surrounds epithelium. So if we think about the most obvious example of epithelium is that which surrounds the entirety of our body on the external, and that would be our skin. So what kind of things is our skin exposed to? Well, it's exposed to temperatures, both high and low temperatures, some of which we can tolerate well, the extremes of which we don't tolerate well, and that causes damage. It's also exposed to UV light or radiation, so from the sun. And we know that in excess, that damages our skin as well. But we can tolerate it up to a certain point, otherwise we would obviously have difficulties whenever we went outside, but different skin tolerates it to different levels. And the thing probably most commonly that our skin is exposed to is friction. So, for example, if you are wearing shoes that don't fit particularly well, they would rub. If you are using something like a pen for long periods of time, you might find you get sort of a callus, so a harder bit of tissue where that's been. And that's all because of friction. But our skin's not the only place that's our only example of epithelium that's exposed to friction. We need to also think about the epithelium that's inside us. So if we think about our intraoral epithelium, so that's the epithelium inside our mouth, that's also exposed to a lot of these different things. So again, we've got temperatures, we've got friction from when we're eating, and you might also have chemicals involved. Now, you might be thinking, why would anybody put chemicals in their mouth? But we do. So, for example, alcohol, caffeine, nicotine in the case of smokers. So, there are chemicals that we intentionally ingest, some of which, in reasonable amounts, don't cause any harm. But all these things are an irritant, and that's the key thing here. An irritant is anything which irritates the epithelium. And our body is really well designed to make changes to help tolerate irritants. And there's levels at which we can tolerate, and then there's levels at which it causes so much damage to the epithelium that we can no longer tolerate it, and then different things happen. So let's think specifically about stratified epithelium. Simple epithelium does not adapt well. Simple epithelium is not designed to be in areas of friction or areas exposed to potential damage. And you know that from the structure of simple epithelium. It's only one cell thick, and therefore it's not going to tolerate very much. Stratified epithelium is where you see these adaptations because it is designed to tolerate friction. So in this example here, we're looking at a 4-layer epithelium, so let's call that keratinized, stratified squamous epithelium. So we've got our basal cell layers along the basement membrane. We've then got slightly bigger cells, slightly smaller cells, smaller cells, smaller cells, until we get to the very surface. The first thing to think about is what we call hyperkeratinization. a long word. But let's break it down so we can understand what it means. So the first thing we're seeing here is hyper. Now, hyper always means more. So if something is hyper, then it's more than it was before. We refer to people as sometimes being hyperactive. Okay, so they're more active. Keratinization, we already know what that means. We've talked about keratin in terms of keratinized epithelium. It's this tough protein that builds up to help protect against friction. So if a tissue becomes hyperkeratinized, it simply means it's just got more keratin than it did before. And we see this commonly as a normal, natural response to stimuli. So if remember, we find the keratin in the third or the second to top layer of our keratinized epithelium. So in the granular layer. Okay, and it's called granular because it's full of these little keratin granules that show up when it's stained. In hyperkeratinized tissue, you see an awful lot more of these granules and they're bigger. And therefore, the tissue on the surface layer, so the corneum or surface layer, whichever term you're using, is a lot drier and a lot harder and more visibly flaky. So the really good example of hyperkeratinization is the calluses that I was talking about. So on the soles of your feet, if you've walked a long way or if you regularly walk long distances, you get sort of tough skin on your feet. Or people who lift a lot of weights tend to get calluses along the knuckles where their fingers meet up with the palm of their hand. That's hyperkeratinization, and it's quite normal. It's nothing initially to be particularly concerned about, particularly if you can identify a specific cause. A common place where we see hyperkeratinization in the mouth is a specific condition that we call smoker's keratosis. So along with becoming tough and hard, when you get calluses, they become whiter because you've got more of this surface layer on your stratified epithelium. And that's what you see in smoker's keratosis. So it occurs on the on the hard palate, which is already keratinized epithelium. And because of this recurrent insult of smoking, you see a hyperkeratinized area. It becomes whiter and harder. So in the hyperkeratinization stage, we're not particularly concerned. It is an adaptation, and you can normally identify the reason for it. The next two things that I'm going to talk about are adaptations that occur beyond the point at which we're tolerating these changes particularly well. And these are changes that we are either concerned about or need to do something about. So the next one I want to talk about is hyperplasia. So again, we've got hyper, so we mean more. And plasia just refers to tissue. So in hyperplasia, you've got more tissue. And where you see this extra tissue forming in a histological sense, so under the microscope, is in the second layer, which we call either the prickle cell layer or stratum spinosum. So that already forms the bulk of the stratified epithelium. But in hyperplasia, we see many more and bigger cells in this area, which therefore pushes everything else up, and you end up with a much thicker piece of tissue than you started with. Hyperplasia most commonly occurs as a result of chemical insult. And it can be chemicals on the surface, but it can also be chemicals that are affecting the way the tissue is generating. So that can be medications, for example. So because a patient takes the medication, it alters the way their tissue forms and we get hyperplasia. Hyperplasia shouldn't be confused with something just being swollen. If you've got swollen tissues, so say for example, you were out for a walk and you went over in your ankle and your ankle gets swollen, that is because you've got extra fluid in the area, because you've got inflammation, because you've damaged something. So there's not more cells, there's just more fluid round about them. That is not the case with hyperplasia. It's not full of fluid, there's actual extra cells. So, like I said, that's more commonly due to a chemical insult of some kind. Remembering that it doesn't have to be on the surface, it could be a medication. And then the last type of adaptation that I want to talk about is what we call dysplasia. So we said already that plasia relates to tissue. Dys means something's wrong, like dysfunctional. So dysplasia is what we would call a pre-cancerous adaptation. So people with dysplastic epithelium are of concern to us. They are in a position where that epithelium may develop on to become either benign or malignant cancer. And all we mean really by cancer or neoplasia, it's the technical term, is abnormal tissue growth. Something's not right. We're getting extra cells or we're not getting enough cells. And dysplasia is when you see changes throughout all the layers of the epithelium. So with hyperkeratinization, we said occurred in this granular layer, and with hyperplasia, it was to do with the prickle cell layer. Well, dysplasia, when you look at it under the microscope, everything's not right. The architecture has changed. The cells are in different places, the cells are not the shape that you want, the cells have got more or less keratin, whatever. It's across all layers. And this is the point at which we actually say, no, this is no longer an adaptation that's helping us. It's an adaptation that has become of concern. So just to go back to the learning outcome, we're asked to describe the adaptations of epithelium in response to external stimuli. We understand that epithelium is exposed to stimuli in various places throughout our body, and that even includes deep inside your intestines. You could still have, say, bacteria or viruses get in there, and that's why we get conditions like norovirus, for example. So throughout our whole of our body, our epithelium is exposed to stimuli. We've had to think about what those stimuli could be, and then what actually happens in the tissues as a result.